Most of the time, the diagnosis and management of valvular heart disease begins with the family practice physicians and internist, and then the patient is referred to a doctor called a cardiologist. The goal of the cardiologist is to make the diagnosis and perform appropriate tests to determine the extent of the problem with the valve. These tests may include an electrocardiogram, a chest X-ray, an echocardiogram, and a cardiac catheterization. Based on the results of these tests, the cardiologist may treat the valve medically, or the patient may be referred to cardiac surgery if felt appropriate. If you're diagnosed with aortic valvular disease and referred for an appointment with a surgeon, the surgeon will perform a full examination and discuss the problem with your valve, and whether or not surgery is felt to be necessary, or whether the valve can be repaired or replaced, depending on the findings of the cardiology studies. Depending on the type of surgery that is needed, the surgeon will also discuss the various options, including a traditional surgical approach by opening the sternum, the breastbone, totally, or whether you're a candidate for a minimally invasive approach. In selecting a surgeon, it is important that you select not only a surgeon with extensive experience in treating your disease, but also a facility whose entire team is well trained to care for you. At Inova, we've been performing heart valvular surgery for more than 30 years, and our experience in replacing aortic valves is approximately 250 a year, or more than 7,500 surgical procedures. In addition, our critical care nurses were recently awarded the Beacon Award. This award was given to 19 of 6,000 intensive care units in the United States. This means that not only are you in experienced hands with your surgeon, but also in your care after surgery.